Thank you.
Okay, here we go. Hi, everybody. Judy Seeger here, and thank you so much for being on the Ozone Summit. This whole week, we have world-renowned experts that are going to teach you about ozone therapy for everything from healing and working with diseases to your teeth to animals. And today we have a wonderful expert that is going to teach you about holistic alternative medicine for your pets and horses. So I'm really, really excited. Thank you, Dr. Shoemaker, for being on here today. Really appreciate your time.
Thank you so much for having me. I'm really excited about this.
Yeah, I am too. This is the one area I know the least about. Even though I'm a naturopath, I know the human part, but I don't know anything about the animals, and I love animals. So I'm so excited to have you on here. And just as a brief intro, we'll get into this a little bit more. I want to share with all our viewers that you have actually been inducted into the Hall of Fame of Chiropractic Animal Care, which is a huge deal. You don't hardly hear veterinarians working on chiropractic, and here you are in the Hall of Fame. So that's very exciting. Plus you do acupuncture, plus of course you do all kinds of other modalities and ozone. So big congratulations, first of all, for being inducted into the Hall of Fame. That's fantastic.
Well, it was a real honor, and I'm just so excited that that exists and that we have people that are so passionate about integrative care for animals, and that we have owners all over the place that are really looking for these modalities to help their animals and, you know, to extend life and to make sure that their quality of life is good. And I am the luckiest practitioner in the world to get up every day and get to do this.
Yeah, so just so we understand a little bit about holistic veterinary medicine, what is that exactly, and what does it all encompass?
Well, we have a great organization called the American Holistic Veterinary Medical Association, and they have promoted for many years the integrative modalities, the alternative modalities, the holistic modalities, and welcome people of all genres to their conventions where they provide exceptional education for this. There are a number of enough members of this organization that are members of the American Veterinary Medical Association that we hold a seat in the House of Delegates of the AVMA. So there is certainly interest in this. We are the guard dogs of the modalities, in that we are making sure that there are white papers out there for the AVMA to understand that people are really, really interested in this. We have a ton of clinical and anecdotal information, and we are working through the American Holistic Veterinary Medical Foundation to promote high-quality research in these fields. The modalities that are covered are myriad, I mean dozens, from chiropractic and acupuncture, Chinese medicine, traditional Chinese medicine, homeopathy, Western herbs, laser therapies, all sorts of types of rehab, and medical management for cancers, as well as just conventional medicine alternatives to things like Cushing's disease, which is really common. And of course, the really big thing with small animals, intractable autoimmune diseases, diseases of chronic inflammation, atopy, or chronic itching, reactions to vaccines, all sorts of different things that are paralleled in the human field, but certainly really a big problem with animals, because animals are, they just have to do what we tell them to do. They eat what we tell them to eat. They don't get a choice. So we have all sorts of things where and our approach is basically start with nutrition. And when you get the nutrition right and you get rid of the food sensitivities, there are a whole lot of things that animals handle and do very well with. So it's the same thing that you've been promoting and that you are talking about. And we're lucky enough to have been doing ozone therapy for the last 25 years. I started doing ozone a very long time ago and have incorporated it into my practice extensively for many, many, many different reasons.
Wow, I didn't realize 25 years. That's a long time. So let's just go back for a second about the whole veterinary medicine. You started out as a conventional vet, is that right?
Yes, I started out as a conventional vet, and I trained in very left-brained conventional vet, and I trained in orthopedic surgery. I do bone plates or did bone plates and screws, and I'm a very much evidence-based practitioner. I make sure that the modalities that I use have enough evidence that they work, that I can feel comfortable in recommending them to a client. And so I try to straddle the fence between the conventional doctors and the alternative world and make sure that people understand that they are both legitimate modalities. And I'm, as I say, lucky to have clients that are well educated and that ask for these things and come to me with really sincere questions, but also a good bit of information to try to make sure that their animals are getting the best of both worlds.
So how did you get switched over from being super conventional and that whole traditional scope of veterinary medicine to the alternative?
Well, it's kind of a funny story. I started out with acupuncture being that, and I was a junior member in a practice that handled some very, very important stallions, warm blood stallions. And there was a stallion that was extremely difficult, very, very difficult, really aggressive, had pretty severe back pain. And so I was given a cookbook acupuncture recipe from one of the people who had gone to China very early in the Nixon administration, very early when the opening up of China occurred, and got some information about acupuncture, brought it back, did a little bit of work in it with the university, but wasn't, didn't go anywhere. And so I got the cookbook acupuncture recipe, went over. This horse came out on poles, literally poles to, the sides of his halter, because he would strike and rear and bite and do all that kind of stuff. And we twitched him, and I put the acupuncture needles in, just a cookbook acupuncture treatment. And he quieted down and was very nice. The next time I came to work on him, I could handle him in the stall by myself. Now, I was sent to do this because I was kind of expendable, If I got hurt by this guy, it wasn't the end of the world for the practice, but I also was a pretty good horse handler. So this was something that, I was really impressed at the change of this horse's affect and this horse's emotional well-being without doing some of the things that we normally think of we have to do when an animal behaves like this, because the mind-body, connection is so important. And his mechanical, physiologic, and emotional being was altered dramatically by that acupuncture. So then I went and took the acupuncture course. And then I was also into chiropractic by having a wonderful person just visit from the universe, came to stay with me, a physical therapist who did manipulation. And I had a horse of my own that was very uncomfortable after having gone to be taught how to drive, very uncomfortable. And he wasn't even moving in the field effectively. And she came and just played with his neck for a little while, and he trotted out of the barn looking really good. And I went, I want to learn how to do that.
And isn't that interesting? That's a lot of times how we get into things. And I know as a naturopath, I had issues. And as I got healed and saw the healings in my patients, I was like, wow, this is like something to really get into and look at more closely. So that's how it works. And then as we study and really understand the intricacies of these modalities, it's fascinating how the body, and whether it's human or animal, can change. And you've worked a lot with horses that are the dressage all the way to the sports, to all different kinds of like high end, where it's very invaluable that those horses are at their maximum peak performance, right?
Absolutely.
So you worked on that. Yeah. And so you've seen it, right? I mean, you've seen it with all these horses.
Absolutely. At the top of their game, and they have to be, if they are Olympic caliber horses, they have to be drug free. So this is huge. Isn't that interesting? Here we have the top end competitors, and they have to be drug free according to the FEI. And so they many times lead the charge as far as this kind of medicine goes. And the basic thing about animals is that there is initially no placebo effect. They don't understand it. Now, there's an immediate placebo effect as soon as you've treated them, because then the next time they see me, they start to go, oh, okay, I'm feeling good. And there's nothing wrong with a placebo effect. It's quite effective in terms of managing a case to have an animal, just like the horse that I spoke to, that was my example. I came and he was excited to see me because he got immediate relief from the previous treatment.
But initially, they don't have that placebo. No. They have no idea. So right. What you see is what you get when you do that. That's fascinating.
I think that's really wonderful proof positive that this is working. It's not a matter of you believe in it or not. It's kind of like the ocean. You don't have to believe in the ocean.
It's there.
And then you get wet. That's just the way.
That's a great example, especially because I'm down here in Florida and I go to the ocean quite often. Yeah. You're absolutely right. It's what you see is what you get. Yeah. Doc, let's get into, because I'm asking every single expert that's on the summit, let's explain from your perspective, what exactly is ozone therapy?
Ozone therapy, I think, is an example for people listening, is kind of like appropriate exercise in a treatment. It's really important for people to understand that ozone, even though it is an unstable oxygen form that we are either injecting into the blood or giving rectally or putting into a sauna or something of this variety, even though it's the unstable active oxygen molecule that we're exposing the animal to, it is not going to cause, under normal pH in the body, it is not going to cause free radical damage. People say all the time, well, I thought that, that inflammation and cancer and all this stuff was due to free radical damage. And that's a free radical, isn't it? Well, an oxidative damage. It is not acting as a free radical. It is acting as a physiologic ion in the system that facilitates an amazing amount of stuff. The biggest one is that it improves oxygen metabolism by virtue of the fact that when an oxygen, singlet oxygen, we call it activated oxygen, is attaching to a red cell, that red cell gives off a magnesium ion, which opens up blood vessels. It makes that red cell more able to give off the things that it needs to give off, its oxygen from its hemoglobin, and it activates an enzyme in the cells. We can get into the science of this. It activates an enzyme in the cells that helps the cell to take on and give off oxygen well, that really makes a difference to the oxygenation and ease of oxygenation of tissues. This is something, this particular enzyme, which is 2,3-DPG, if you want to know, the diphosphoglycerate, this is really lacking in diabetics. This is why they get diabetic, loss of limbs. Diabetic people can have their toes necrose and go away because of the fact that their tissues aren't being oxygenated. And ozone therapy can completely fix that. So any situation, anytime an animal is not being able to move around because it has disc disease, or it's lame and it has to be in a stall, or it's not able to move, we can give them ozone and give them the benefits of being a normal physiologic being that's moving and get the oxygen to the tissues so they can heal. And this is really, really important. And that's why we use so much ozone therapy in this practice.
Yeah, 25 years, that's a long time. I think you won the prize for using it the longest as far as the experts we have on here. That's a long time. And how did you hear about it? Did you see it first in use, or how did you get into it?
I was a very wonderful practitioner in Florida who said, he was into this, very interesting, innovative homeopath that come up and said, you ought to do this, and treated my own horse who had a terrible infection in his joint. Literally a dog food diagnosis problem of a septic arthritis. And sorry about that graphic expression there, but anyhow, he treated my horse, and my horse recovered. So once again, as you say, anecdotal experience, personal experience is always a great thing, but I want to share those things with people so that they understand that this is and I was very lucky to have a client who bought my first ozone machine for me because she wanted to have her horse treated, her laminitic horse treated. And she bought it. I did it. Every animal that I worked with responded extremely well. And so I was on my way. I literally, every horse that walks through my practice for whatever reason, I mean, even some people who know about it, just coming to get a Goggins test, ask that their horses get a dose of ozone because it facilitates their training. It helps the animal feel better. It helps them with their pain. It makes their feet grow faster. It helps their coat. It does all sorts of things that make a difference. So yes, when I say, I've been doing it a long time, I have delivered thousands and thousands, maybe tens of thousands in this time, ozone treatments. So, and
what I love about with the animals is as soon as you administer it, you see the effects right away. Yeah. People will say they feel great and feel the effects, but animals, I mean, you could literally see them go from limping along to all of a sudden they're not limping, right? So I know that you've seen that, and you've seen that in your own animals as well. What is the best, maybe not the best, but what are the different ways you're using the ozone as far as application goes?
All right, with the horses, we are able to give ozone in strengths that are not damaging to red cells or damaging to tissues. We give it actually directly intravenously. We don't have to do what's called, major or minor autohemotherapy. We don't have to take the blood out and mix it with the ozone and then put it back in. We don't have to take the blood out and mix it with ozone and inject it intramuscularly to stimulate things. We can actually just put a needle in and give 360 cc's of ozone at a perfect, the right concentration intravenously. Give it slowly because there's so much blood volume and there's so much turbulence in a horse with a great big huge heart that it's impossible to embolize them. So direct IV is really the way to go with horses. With small animals, you can do major or minor autohemotherapy. As I said,
can you explain that so that people understand?
Major autohemotherapy would be taking blood out of the animal, putting it into anticoagulant, heparin anticoagulant, container, and then mixing it with ozone, and then infusing it back into the circulation that way. Minor autohemotherapy is just taking a syringe of blood out, mixing it with the ozone, and injecting it back into a muscle, intramuscularly or subcutaneously, to catalyze or instigate a reaction to the oxygen facilitated reactions in the blood. And then that can stimulate the body to do that, en masse. And so those are the two ways that we can.
Why would you use the two different, the major versus the minor, for the different animals?
Because a little tiny animal, you could actually embolize it if you gave it IV.
Okay.
And then also, the major way that I do it, however, is much simpler than that, which is to take a catheter and to give it rectally. And we can put ozone.
And animals sit still for them?
Oh,
for that?
Absolutely. Absolutely, they do. I mean, we're gentle about doing it, and we use a lot of lube, and we also moisten the inside of the intestine of the bowel with some saline, and they absorb it really directly through the bowel wall, and the blood vessels take it just as it does, any nutrients as well. It takes it to the liver, so the liver is the first place that this ozone goes. And it facilitates the liver doing its job. And of course, the big thing that the liver does is detoxify the system. And so to get your liver, all manned up here as far as doing its job, having plenty of oxygen and having what it needs to do its job, but also to renew itself, because the liver is an amazing organ. The only thing that limits how many transplants you can get out of a donor liver is the plumbing. Artery, vein, and duct, because livers have the ability to reproduce their cell and to be big enough to do what they need to do. So that's why we want to take care of the liver and its job of detoxifying and eliminating the side effects of inflammation as quickly as possible. You got to have a way out for this stuff to allow drainage, to then allow the processes of cleanup to occur. We can't have a backup. We can't have a limiting step in detoxification. And I know that that's what you're all about as well on your website. And so this is where ozone therapy is such a boon.
So when you put the catheter, right, into the animal rectally, how long does that last? How long does that whole process go for?
Okay, what we do, as I say, we do this. The animals are sitting usually on my electromagnetic therapy blanket, and their parents are there, and there's a varying amount for the size of the animal. We do cats, we do big dogs, we do ferrets, we do all sorts of animals, and we put that in, and then they have to hold their tail down for about 20 minutes so that they don't fart it out, because we'd like for it to stay in there long enough.
Because that's exactly what happens. It's a gas, so that people know. It's a gas that comes in, and it can't harm them because it's just a little gas. If anything, they do fart it out, but then you just do it again. So it's not a big deal.
Absolutely. The major thing is to be gentle about getting it into the animal so you don't cause any pain. And we use a very, very thin polyethylene catheter, or a red rubber catheter, a French catheter for the kitties that does that. And we infuse it slowly enough that they don't feel any visceral stretch discomfort. And they get very used to it. And I think they very quickly make the association between this absorption of oxygen and the heightened brain feel goods and the energy that they feel in their muscles. And as I say, without anybody having any attitude of, oh, that's going to be uncomfortable, because of course animals are really sensitive to what people are thinking. So if they get the owner to say, this is the best thing since sliced bread, and the animal says, well, it's the best thing since sliced bread, then they will do very well. And the next time they come in, they go right into the room to be treated, and they don't have any problems.
Sometimes the owners have to be educated a little bit more than the animals, yeah?
Absolutely. Absolutely. This is so important. And that's why in my practice is really an educational practice. And that's exactly what we try to do, is to have well-educated clients that can assist their animals physically, physiologically, and emotionally, and make sure that their mission is embodied as well as being thought about. We have to make sure that it comes across in every way, and the animals really respond really, really well to it.
Yeah, and that's a real important point you just said, because I used to do the same thing in my clinic, is educate the people so that they feel confident, they know it's safe, they know it's effective. And once they realize that, then the animal, of course, like you say, absorbs that, and it goes much more smoothly. So that's fantastic. So do people walk in, do they know about all these different modalities, or do you educate them on all the modalities that you have there?
Well, I'm very lucky in that at this point in my practice career, people are seeking this practice to do these things because they are actually much better educated than they were 25 years ago. I started doing this kind of medicine in the late 80s, the mid 80s. And so at that point, it was, we couldn't talk about some of these things, you were considered like, ooh. And it was quite difficult to bring people, into the fold here, come over to the dark side. But now people are seeking this out. And the thing that's very interesting, in some ways, veterinary medicine is a little bit behind the conventional medicine cutting edge. But in some ways, we are so far ahead because people will do things with their animals that they wouldn't necessarily do for themselves, not only because they're codependent and they're going to take better care of their animals than they would themselves, but also because of fear. So they are willing to let their little animal be out there as a guinea pig and to try something like this that they've read about. And that is one of the most wonderful things going. So many people in my practice have had their animals treated and say, well, do you know anybody who does this for people? And so the animals are my partners in crime in doing what your mission is, which is to spread the word about this kind of thing. And the fact that, yes, they are not judging whether or not it's going to work beforehand, and they are demonstrating that it works immediately or effectively over time, and doing it and responding quickly enough that an owner can see it.
And it's like a whole like you just said, it's a whole family affair. If we can get the pets and the people doing this together, it's a phenomenal effect. And everybody feels better, and everybody's happier, and they're enjoying their walks more. And nothing makes me happier than watching a dog park where you see the animals frolicking around and the people frolicking with them. Just makes me really happy to see that. So Doc, let's just talk a little bit about the modalities, because we know that ozone therapy is not the magic bullet, even though we'd like to say that.
Right.
It's not. But it is a huge, powerful therapy, of course, that we like to teach. But you teach other things as well, from the diet to other modalities to this holistic approach. So let's put it all together and teach people, what does it really take when an animal comes in and has pain? What are all the different things that you discuss and look at to help that animal?
Now, I should have my little picture that I give to clients on this, but we'll kind of draw it in space here. There is an absolute necessity for long life and quality of life. There is an absolute necessity for balance. Now, balance is not some highfalutin philosophical thing. It is physics. It is mechanical balance is first. So we have to have a mechanical base that is your relationship with gravity. You're either balanced or you're not. You know, oh, I'm better than I was. Well, yeah, you're still, you know, we want to find balance. It does have a philosophical portion, but still, mechanical balance is first. And so that's where we work very carefully with animals for many ways. That's where chiropractic comes in. That's where acupuncture can come in. And we work extensively with foot care. Toenails on dogs must not touch the ground, because if they do, they think they're standing on inclines that don't exist. So when their toenails touch the ground, they lean up this hill that isn't there, they're stressed. And it causes disc disease and hip dysplasia and cruciate tears and, you know, and emotional and physiologic stress. So then we have to work with physiologic balance. And that is basically, that's nutrition. You are what you eat. Period.
The foundation and everything, isn't it?
Totally important. But even if you're eating well, if you're physically unbalanced, you're going to have a problem. So we have to work with these two. Then we have an emotional balance. And that is all of these. This triangle is, if this one is compromised, physiology and emotion have to adapt and compensate. So when we have balance in all three of these areas and they influence one another, this complex system, and I mean that by virtue of the complexity model, is incredibly interactive. And so we can learn what the points of maximum influence of this complex system are to affect this balance. And so indeed, mechanics in my practice comes first, physiologic balance through nutrition, and then the emotions sometimes come along for the ride, but we can also influence those through essential oils, homeopathy, flower essences, many different things. I use an immense amount of emotional freedom technique, or EFT, tapping on both animals and owners to help create emotional balance and get rid of baggage that might be limiting the system. So in this, we include, in my intake form, which is about 6 pages, we include an awful lot of information about the household and things that are going on in the household so that might influence an animal's health. And so we kind of involve the whole family system in this, because they are part of a family. They are part of an environment that they can be the canary in the mine shaft if there's a problem in the family. Many animals have come in and told me about the fact that there's abuse of some variety going on in a household, and you know, we have to sometimes address that.
So you do a little counseling on the side with the animals too, yeah?
I'm not licensed to do it, but we certainly point people in the right direction and have reference resources for them to go. And I feel very, very good about the fact that we've done some pretty impressive interventions over time to help whole families with issues that the animal treated brought to the forefront.
I don't think people realize how much animals or children or, you know, the beings in our circle, that they don't realize how much they absorb of the negativity that happens in their environment. And it affects all of us. It affects everybody on every level. So I'm really, really glad you brought that up. That's near and dear to my heart, to talk about the mental, spiritual, emotional part of healing. It's really the foundation of all healing.
Absolutely.
So, yeah, it's very, very important. So, Doc, let's put this together with the ozone now. So we have all these different modalities. How have you found, maybe give us some examples, how have you found that ozone speeds up or increases the healing process for the animals?
Well, we're all learning at this time about the effects of appropriate exercise. We're learning that, jogging 20 miles every day is going to wear your body out and shorten your life. We are figuring out that for millions of years, you got chased by or were chasing something about twice or three times a week, and you ran to exhaustion and rested a while and then ran to exhaustion. And that's where the stimulus for joint remodeling and muscle building and balancing ghrelin and all of the different hormones that we have to balance to maintain appropriate weight, have an appropriate metabolism, use the food that we eat. And so what ozone, when I opened up saying, this is kind of exercise in a syringe, that's what ozone can do. Ozone can create the physiologic environment that would happen if an animal or a person got the kind of exercise that it was supposed to get a couple of times a week, once, 2, 3 times a week. So basically, right there, I think we can talk about this. We're all sedentary. Animals are sedentary. Horses live in stalls instead of running around 25 to 40 miles a day. So what ozone can do is to create the physiologic environment that would happen if they were living like they were supposed to. So I think that's the basic way that we can describe it. Now, interacting with other modalities, wow, if I get joints in motion.
Takes it to another level.
Yeah, that are stuck, and those joints haven't seen oxygen for months or whatever. I love jugging that horse with oxygen and having those joints get what they need to go back online. I love having oxygen in the system to take nerves that are irritated because they don't have oxygen, and all of a sudden they get enough oxygen and they stop screaming that they're in pain. I love giving an animal that kind of bolster to its brain that turns it on. Then when I give a flower essence and it smells something and it's the basic thing of its deep portions of its animal brain get this information, and then they've got the wherewithal to use it, that makes a difference. And so it augments the effect of homeopathy, it augments the effect of flower essences, it augments the effect of everything. And if they are on conventional drugs, it helps them to use them effectively and detoxify from them if there's, an issue of, I can get animals on less non-steroidal anti-inflammatories. We can have the reduction in the need for long-term antibiotics in the treatment of Lyme. We can help the gut bugs to survive when, there is an unnecessary use of antibiotics. We can reduce, one of the biggies is we can reduce the amount of pergolide necessary for a horse who has PPID or pars intermedia dysfunction, Cushing's disease, which is getting more and more common because of chronic stress in horses. So this is how it interacts. It makes everything work better. Conventional medicine, drugs, homeopathy, nutritional support, it makes everything work better because it's, again, basically exercise in a bottle. There's this kind of thing, if you're moving, you're probably alive. If you're not moving, you're probably dead. So
there's parts of you that are dead, that's exactly. For sure. Yeah, you got blockages. People don't realize how, because I push that all the time as well. Circulation. As soon as you've got a blockage, now you have disease. Now your body has to deal with it. We need to bring it back into balance. And that blockage could be caused from, like you say, emotional, mental, spiritual, or physical. Many, many different venues of that. You're absolutely right. And so give us an example of something dramatic that you've seen where the animal came in, or you saw the animal and it was in extreme pain, or something, was really causing that animal to suffer. And then you used the ozone or your modalities, and then you saw that, wow, that wow effect is what I'm looking to see.
I think some of the most dramatic ones are with some cancer cases. And we have animals that are, they're tolerating their treatment. They may be getting conventional integrative care. They may or may not have had chemotherapy or something of that variety, but they come in and they've just got that hangdog look, and they're painful. They won't raise their heads. Their parents are concerned about them because they are wondering if they really want to do this. They may be saying, well, I don't want to do chemotherapy because the animal's not, I don't want them to suffer by feeling bad with chemotherapy. Or they say, we had chemotherapy and the animal suffered so horribly with it. And we give them ozone therapy along with those balancing modalities where they can get rid of their physical stress and such like that. But even before they've been able to eat new food, and even before they get ozone therapy, you can sometimes just see that relief. Their necks lengthen, their eyes come up, their facial expression changes, and you can tell that they are feeling better. And many times after they've had ozone therapy, they want to eat. So that's usually an indicator to me that, we're kind of thinking like we want to live. Once again, if you're moving, you're alive. If you're breathing, you're alive. If you don't breathe and you don't breathe internally, like you're not getting enough oxygen, you're going to die. So that is where an animal is going, oh, I'm collapsing, I hurt, I'm cringing, I'm not cringing, I'm using my diaphragm effectively. That's part of that's chiropractic as well. But even still, if they can get oxygenated, then they feel like looking like they're oxygenating. They're using themselves like they're oxygenated. So it's a circle, it's a kind of it's a chicken and egg. So if we can create the environment of, here, this is what it feels like to be oxygenated, and then they can be given the opportunity to manage that themselves through the modalities, then we can jumpstart the system. This is where and to be able to jumpstart it in many different places, mechanically, emotionally, but certainly physiologically through adding the oxygen. Because one of the things that happens with people and animals is that they don't do anything they don't feel like doing. Now that's regrettable. We have people do, I want to lose weight, and I want to, I want to get fit, and I want to, I want to get well. Well, if you don't feel up to it, you aren't going to do it. It doesn't matter whether these things are there available to you. Look at all the beautiful information that you have available. But people have to feel like it. They have to feel up to trying something. And this is where I feel if we could get people to exercise, bunches of them would get better. But sometimes they don't feel up to it. But an ozone treatment can give them this is what it would feel like if you exercised, or if you moved, or if you breathed. And they go, oh my gosh, I could feel that good? Yep, you could. And then once they've had a little taste of it, it's once you've had that little taste of it, then you're willing to do it.
Right. No, exactly. That you're so right. I remember the first time I had Lyme disease, I went for my ozone therapy, and I couldn't believe, I came out of that sauna with I was like, yeah, that's exactly. I was like, wow, I want to feel like this all the time. I felt like I was 20 years old again. It was fantastic. It was really great.
Another personal experience that I had with ozone therapy, and it was an ozone sauna as well. I did ozone saunas once a week for quite a year, and I have Lyme disease and a bunch of other things as well. But I have inherited autoimmune type disease like Hashimoto's thyroiditis, and I have Raynaud's. I have poor circulation, and I put my hand on a metal gate, and my hand turns purple, and it hurts like mad, and I don't tolerate the cold very well. Well, that year that I did ozone saunas once a week, I did not have a single Raynaud's attack. And I am a veterinarian that has to be out in the cold and do acupuncture without gloves on and putting needles into horses' backs in cold barns. And I have a farm, and I've got to do, and it was delightful. The two things that make the biggest difference for taking care of my Raynaud's are ozone therapy and mohair socks and gloves, which are electrically active and help things to work. So for diabetics, those are some of the things that we can really make a difference in. So I think those are really important things to realize. There are electrical things that happen with ozone, with certain types of clothing, with homeopathy. There are informational things that occur that can alter circulation and neurologic function instantaneously. So what our bill is, oh, that was a placebo effect. That was a miracle cure. That was what miracle cures happen all the time. And frankly, they're not really miracles. They're just the way the system works when stuff is put together correctly and you get the right response. And so we don't want to discount those things as something out of the ordinary. You need to be better practitioners in creating the balance that allows the system to do that, because the body wants to heal.
Dr. Shoemaker, that was really well said, and I'm really glad you said it that way. It's just a matter of getting people to realize that not only for themselves, but their little furry pets could all feel so great. Typically, when they come into your clinic, they have to have a series of ozone treatments, right?
Yes.
Can they do this at home as well?
It's not rocket science to administer ozone. I have them schedule in the office to do it because people could either rent an ozone, you can buy an ozone machine on the open market. It's an over-the-counter item. Buy them on Alibaba. It's not something that's hard to get. I feel very strongly that, and I have to because I have a license to protect as well, that it should be administered under a doctor's supervision several times to find out how the animal responds. And if an owner is going to be doing rectal ozone or something of that variety, that they understand the dangers, that they could perforate the animal's bowel if they're rough in putting the catheter in. They need to be able to watch to see what the animal's response is. I listen to their hearts many times very carefully while they do this, because you can, especially with a horse, you can lower their heart rate so much that they faint. And having a 17-hand horse hit the pavement's not exactly exciting. In addition to that, there are some dangers of horses being given, if people are giving intravenous ozone, people give intravenous shots to their horses all the time. It's something that's, we're not going to stop that. We're not going to, veterinarians would like to say, oh, well, I'm the person that has to do this. Well, guess what? People have been doing it for a long time. They're going to continue to do it.
Right.
So, and if one by accident does an intra-arterial stick on a horse, you're going to kill it. So just flat out, it's going to die. So we have to make sure that people understand the dangers of the techniques of administration, but the actual treatment itself has an incredibly low incidence of side effects. The worst side effects can be a Herxheimer's reaction, which I'm pretty sure you've probably talked to people about, which is when you start a healing cascade and it's happening a little bit too fast, there are a lot of toxins released and blood pressure can change, and it can be a little scary thing. So there is the danger of Herxheimer's reaction. There is the danger of technical administration error and such like that. So I do kind of request that people come, see if they feel like they can handle what's going on with this, instruct and educate them as to how to do it if they choose to do it. Then they can buy their own machine or rent a machine and do it at home. I have many people who have animals with cancer that they're going to be needing to be treated 2 or 3 times a week, and they live hundreds of miles away from me, so they may choose to do it themselves.
Right, and that is the issue. So as far as the Herxheimer, I definitely, with people, avoid all that by teaching them how to detox beforehand. Yep. And my people don't get the Herxheimer's, or very, very, very small amount of symptoms of that. But with animals, you can't necessarily detox them first. So right. That's a little bit different.
They're not as toxic. Well, some dogs may be by eating really creepy food and stuff, but horses in general are not as toxic as that. They may herx with severe current infections with bacteria or viruses. They may have a little bit
die-off from that. Yeah, exactly.
The die-off can be a problem. So again, I think it's really important when we talk about ozone therapy to have the oversight of a knowledgeable practitioner. I mean, it's not something I cannot recommend saying, oh yeah, go buy yourself a machine and do this. I don't even myself do an ozone sauna without somebody in the household checking on me every once in a while, because again, once blood pressure can go down, there are many things that we want to watch, but in general, administered correctly with appropriate supervision and such like that, ozone is one of the safest things. It's breathing, breathing's pretty safe. So it's one of the most incredibly safe things to do. So
right.
I want people to understand that it is available, and we need to encourage practitioners. I've encouraged many practitioners to buy ozone machines. And
yeah, we're trying to teach the practitioners. We do tell people that they can do it at home, but we're with you on that. Go get some treatments done first for yourself or your animals. Make sure you know how to do it. Get some training with some people who are knowledgeable. We have a team that trains people specifically. So if they want to use it at home, it's very safe, it's very effective, like you say, but you got to know how to apply it, how to use it. So really, really glad you said that. It's always, you know, anytime you're using something that is a powerful technique like ozone, you want to be trained the right way. You really want to be known how to use it in a way that is effective for you. And it's not, like you say, it's not rocket science, but you do need to have a little bit of training along to go with it. So that's exactly right. Doc, this is great. Let's just wrap up and teach people that in general, when they're looking at ozone therapy for their animals, and they're still, you know, riding the fence and not sure about the safety and efficacy of it, what do you encourage people? What can we leave them with as far as advising them in using ozone therapy along with the other modalities so they feel like, yeah, this is something I really need to look into?
I think that, as we've said all along, there isn't any way for an animal to utilize all of these other modalities if the tissues are not getting the oxygen and the energy that they need to have the mitochondria be able to produce ATP and fire the furnace of the cell. It takes good nutrition and building blocks, but those can't be used unless there's oxygen. So since breathing is good, then we can say that ozone therapy is going to augment that very basic part of being alive. I mean, it just makes sense. So the other thing about it is that it is relatively inexpensive. It has very few side effects. And what's not to love?
Yeah, it's safe. I mean, that's really what we want to get across to them, that the amount of side effects from ozone therapy is like 0.00007%, whereas medication, of course, is, you know.
Yeah. I mean, it's less toxic or has fewer side effects associated with it than intravenous saline. So
wow, that's saying a lot.
Statistically, that's it. And then the other thing is this misunderstanding of, oh, I thought free oxygen or free radical oxygen or oxidative damage was the cause of aging and cancer. One has to realize that ozone is produced in the system naturally when you exercise. You have peroxidases in your system that create this physiologic singlet oxygen when you exercise. And so in normal pH bodies where things are, you know, moving along slowly, you don't have this oxidative damage. Now, if you did it 3 times a day, 7 days a week, just like jogging or running 3 times a day,
too much.
It's too much.
Right.
So here we are in America, some is good, more is better, and excess is best. You know, that rule does not necessarily apply here. We don't want to have that happen. So we want to make sure that people understand, used intelligently, used appropriately, with good technique, we are actually doing such incredible good for the immune system. It augments the immune system's effect. It helps the killer cells get cancer cells. It helps the lymphocytes that need to label things for being taken away do their job. But then it helps the T suppressor cells to tell everybody, okay, you've done your job, chill out, don't cause more inflammation. So it does those things, and it helps the oxygen to be released. It helps the blood vessels to open. It helps so many actions within the system of cleanup and healing that, as I say, what's not to like about that?
Well, I think your message is really clear that people need to hear, and I'm going to reiterate that, because if they missed it, they better get it this time. Is that you're saying that they need the exercise, but when the animal, and it's humans too, but when the animal doesn't feel like it because they're in pain, they have cancer, you need something to get in there to increase that movement inside the blood cell, and ozone does that. That's a powerful statement right there. It's like an exercise inside their blood that they're not going to move if they don't feel like it.
Absolutely.
But that's a brilliant statement. I hope people really understand that. That's huge.
It's a dose of feeling good. And some of the other things that go along with management of it, again, good technique, proper nutrition, because you have to have, things to help glutathione, the detoxifications. You have to have the vitamin E and the N-acetylcysteine and, the appropriate amounts of selenium and things like that really help the body's own free radical management system to function correctly. And then it's a trigger to make it practice. It is a trigger to help the system do its job effectively and utilize all the wonderful nutrition that, a practitioner such as yourself might be advising them to do. And it also then helps the animal or the person to balance. Once again, we get back to the mission statement of my practice of creating balance in the system. All the nutrition in the world, but if you can't utilize it, it actually becomes sludge. It's a problem. Right. You can have all of the emotional stuff in the world, but if you can't get over that hump of feeling like it, it isn't going to happen. You can want to move.
And the ozone just kind of gets them to that next level to be able to move and get things going. It's
like a deep breath, which can really help everything.
Yeah, exactly. Dr. Shoemaker, that was like such a great lesson. I love the way you put that. And I know that the viewers got that too, because you just put it very simply. You had it just laid out for us. That was brilliant. Thank you so much. And all the viewers who are on here, thank you for watching. We appreciate each and every one of you. Those of you who want to get in contact with Dr. Shoemaker, we'll have all the information here for you. No worries. You could get in touch with her. But bottom line is, take a look at what ozone therapy can do for your loved ones, your little furry loved ones. We'd love to have you guys get into that. So we will see you guys on the next interview. This is Dr. Judy Seeger. Take care. See you next time.